Hi, everybody. Dr. Daniel. Today I'm talking about when to treat a migraine headache. Well, you really should treat it at the prodrome, which is like up to 12 to 24 hours before the headache starts, if you can recognize a prodrome. Or should treat it at the onset of an aura. If you're one of the 30% of patients who have migraine with aura, like a visual attack, then you would treat it then. For the rest of the patients, they'll need to take it at the onset of the headache. And doing that, in general, can give 70–80% of patients who have migraine can be headache-free in 2 hours. So migraine has a cycle of events that occur in the brain. It's a neurochemical inflammatory condition in the brain where the trigeminal nerve activates, neurochemicals released, the arteries vasodilate, and then it turns on the thalamus, which is the pain center of your brain. So you've got like 20 to 40 minutes after the onset of the trigeminal nerve releasing these chemicals to take the triptans, because triptans block the release of those drugs. And even though triptans came out with injectable Imitrex subcutaneously in 1991, they're older drugs. They're still the king of the hill. They're all generic. They're cheaper. They do have possible mild side effects. Nothing bad. Most persons can take them. They should treat at onset if you can. The persons who can't use triptans could go back to old drugs like ergotamine, which just comes as Caprigot or Caprigot suppository. They can take DHE, which is a nasal spray, as Migraine. They can use DHE injections. They could also take one of the new drugs that came out this year. I'm talking about 2020. So Rayval, Nurtec, and Ubrevely came out this year. The new drugs can be used, but all these drugs are name brand. They're expensive. None of them work as well as the triptans for onset of treatment of migraine. All right, so a lot of folks don't treat at onset. So why don't persons with migraine treat at onset? Well, one of the main reasons would be that they're hoarding the drugs because they may only get like 9 prescriptions in a month. I've seen patients in the past who only get like 3 prescriptions, even though I write it for number 9 per month. They only get 3 for every 2 weeks. They have to go to the drugstore every 2 weeks to get their drugs. So and the headaches may come more frequently than that, and so they're hoarding them so they don't run out of their triptans before the headaches come on, and that's unfortunate. Studies been shown looking at that is that these folks have a higher incidence of development of medication-induced headache, which is over-treatment. It was like drugs that'll cause headache. So over-the-counter drugs like caffeine, Tylenol, Advil, even triptans, or worse drugs like opiate narcotics or butalbital, is like Fiorinol is the drug there. They can cause medication-induced headache if you take too much of them. And that's the number one new patient for migraine practice is someone who has chronic migraine with medication-induced headache and overtreating. And the biggest issue there is caffeine. The American Headache Society says caffeine is the number one drug folks use for overtreatment in America. So studies have been done that shown that there's an increased number of ER visits or medical care and expense for treating migraine if the patient don't have enough medicine and they're hoarding it. So it'd be better for insurance companies to give more drugs so they can treat their drugs with their headache with a triptan. The other reason would be that it's expensive. The copays on triptans, even though they're generic now, are somewhere between $10 to $40, and they're expensive, and who wants to spend all the money for that? Yet migraine is a chronic disabling neurologic condition, so you just got to treat it, hopefully. Another idea would be sort of a nihilism idea. Folks think that nothing works, and they've never really taken a triptan at onset of the migraine. They'll say that doesn't work, and many patients, I've instructed them carefully in the office to take their drugs when the headaches come on, keep them with them, treat early. They come back the next visit, wow, the drug worked, and the headache went away in like 30 minutes to an hour or something like that. But persons who haven't had that instruction and don't treat early, they're nihilists, and they think nothing works, so they don't want to have to get into that kind of thing of using triptans. They just don't believe it. Another reason would be patients have fear of overtreatment because a lot of chronic migraine patients have developed somewhere during their life, unfortunately, they developed headaches that may last weeks, months, or years. So daily headaches, which is medication-overuse headache, and they're afraid they'll get it with triptans. The International Classification of Headache Disorders lists that if you take more than 10 triptans a month, you can get medication-induced headache. So hopefully you'll keep the numbers down about 2 a week is what we try to teach in that regard. Another thing to keep people treating early is concern for side effects. Well, triptans do have side effects, and the ones most commonly I've heard in my practice have been a flushing feeling, feeling sedated or kind of sleepy. They may get a tingly feeling in their fingertips. It's usually transient, goes away. They may get a tight, squeezing pressure feeling in the chest area or the neck. I explained that particular symptom as being that migraine causes your arteries, your brain to dilate, vasodilation, and triptans cause vasoconstriction of smooth muscle, which gets the artery, but also gets the esophagus and the trachea, which is in the midline chest area. And so they're just having a symptom for that. And many folks hearing that will think, oh, no big deal, they'll go ahead and take their drug. I usually always ask them if they get a triptan side effect, will they get rid of the headache? And they'll say yes. And so if we can get past the side effects, many times that's helpful. If it doesn't work, the doctor can always lower the dose of the drugs. Like if you're given 100 milligrams of sumatriptan, you can drop that down to 50 milligrams, and hopefully it'll help the headache, get rid of the headache, but it won't cause many side effects. Or one study showed that 6% of the time, if you switch the triptan to another drug, it'll work. And so you try another triptan, that will work. Another idea here would be people just wait. They don't want to treat early. They want to wait and see what happens. Many times they think the headache will go away on its own, and maybe they've had an experience of that, and that's good, but in general, the headaches will not go away. So they wait and they don't treat, and they end up in the ER, or they, have a terrible headache that doesn't go away for a long period of time. And so waiting is not to be desired. You should treat at onset. Another problem is a lot of folks with migraine will have nighttime wake-up nocturnal headaches. And they sometimes occur at middle of the night, at the end of a dream, or they'll occur, just about a couple hours before you wake up. And those are called wake-up headaches. And I instruct my patients put their triptan in a glass of water nearby their bed so they can wake up, take their drug, roll back, go back to sleep if they're not feeling that bad, maybe go to the bathroom and come back to bed, and then they can treat earlier rather than waiting to see what it's going to be like the next morning when they wake up and there's a hammer on their head with this horrible migraine headache. So you should treat nocturnal headaches also. The final thing is, like you'd hear, as a doctor, you'd hear why people don't treat. Well, excuses. Well, I was driving to a meeting, I didn't have my medicine. Duh, you got migraine. You need to put that in your purse or your briefcase or in your pocket or in your car or something and stash them away so you can treat them early at onset. Or, I was in a meeting, I couldn't take a drug. Well, you can always leave a meeting, go somewhere and take a glass of water and take your pill and things like that. So try to please grow up and work through excuses. So again, I'm going to end this talk by saying triptans are the best drugs. Carry them with you, treat early, and good luck with treating migraines. Thanks for listening to this. I'll see you guys on the next talk.